Schofield, and I'm from the Centre for Medical Education, and I'm going to talk to you about the social and educational impact of hospitalisation on children, the attitudes and experiences of medical, nursing and education students study in Tayside in Scotland, and each year 5% of Scottish children are inpatients. In Scotland, the age they go up to varies, and in Tayside, 14. Once they get 14th birthday, they go to the adult wards, unless there's special circumstances. We know that a lack of ICT causes social and educational isolation, and reintegration can be eased by good communications with therapeutic staff. So just to give you a little background about Tayside, this is what currently happens. If a child is involved in a school, then that's overseen by the local education authority. If the student then goes into hospital, then the hospital education service looks after their educational needs. So my research questions for this study are, what are the medical, nursing and educational students' own experiences, if any, of interruptions to their education due to hospitalisation? What are the doctors' and teachers' own experience of helping children with interrupted learning? And what are their attitudes to and knowledge of hospitalised children's education and reintegration? So this is my rates of return, and you can see here why I used face-to-face as much as I could. So phase 2 was at the end of a lecture, and I got 94% rate of return. Phase 3 was more complicated because then they're broken into small groups and they're rotating around, so they could be anywhere in the Tayside area and even beyond. So sometimes I had to use online questionnaire for that. Education, again, was in a lecture, and I had a high rate of return. The lecturer then took some to give to other people, so I put a question mark about how many were approached. Nursing was a small group, child nursing, and was 100%. The doctors was administered personally by the consultant I was working with, and again 100%. For the teachers, I posted them out to any of the schools where a pupil in the first half of my PhD had said that they were a student. The paediatric doctors and teachers were involved in child's education, while the junior doctors reported no involvement at all. Senior registrars, about 25%, and half of the consultants and associate specialists. For teachers, as you remember, I was saying I just posted them out to the school and I didn't know where the head teacher sent them, so 50% almost had been involved with the child's education of the questionnaires. I wanted to know what they actually knew about what was available for these children. So looking at the 8 to 12-year-olds, at 12 they get access to a separate room, a school room that has a computer in, but under that age they're just really, it's what they've got access to at the bedside. The children are allowed to take their own laptop in, but they're not allowed to have web access, which obviously means they've got no email, they've got no social networking, they've got no webcam. I'd asked specifically about webcam because there's evidence in the literature to suggest that setting up a webcam link between the child in hospital and their school can again reduce feelings of isolation. How many of you use Facebook? I am addicted to Facebook, and someone just posted this yesterday, so I thought, oh, that's perfect for my talk, because this is Maslow's hierarchy of needs. And Don Thorson had actually added underneath the internet. Now, okay, I know a lot of our lives are really based on the internet now. I probably wouldn't put it as more important than air, water and food. But certainly for this level, social needs, I think it's very important now, the internet. And also self-actualisation, creativity, problem solving. And yet, when the child's in hospital, they're denied all this because they can't get on the internet. There's a lot to suggest in the literature that teachers are worried because they don't know when the child is reintegrated, what can they cope with. What can they do physically? What can they do mentally? What can they do socially? So my personal feeling was that printed information on the illness would be very, very useful. And this seems to also, a lot of the educational students felt that. But for doctors, it was well under 50%. For the nursing students, just under 70%. Half of the doctors who'd experience of involvement with the education of the hospitalised child thought there should be a visit to the teacher, compared to only 17% of those with no experience. So they were more likely to feel that they should be involved with the teacher if they'd actually had experience of supporting a child's education. Second year medical students, more information is needed for medical students of what will be expected of them. Another one said, I'd not thought of education and children in hospitals, and I hope there's adequate provision. And another one said, I'm currently completely unaware of any hospital education service, which is fair enough maybe for the second year students. By phase 3, the ones I was actually giving the questionnaire to had done 4 weeks in the children's ward, and yet there was no significant change in their knowledge. So this quote really, I felt, summed it up. I really hadn't considered this subject before and don't know anything about the hospital education service. I think more knowledge on our part is important for working in paediatrics and maybe for being a GP too when the child is discharged. So it would be useful to include a session on this in the paediatrics block. So remember, these are ones who had done a 4-week paediatric block. And there's a growing body of evidence suggesting that interprofessionalism offers greater benefits for patient care and safety than multi-professionalism. So is there some sort of interprofessional intervention we can do?
What's the difference between inter and multi then?
Interprofessional is when they're actually working together. Multi-professional, you might have nurses in the same room as doctors, as educationalists, but they're all looking there to the tutor, they're working in their own groups. Interprofessional, you might have a nurse being a student, a medical student, an educational student actually working together. Who has responsibility for which bit of the child's educational and social well-being? A lot's made of the patient journey for adults. So, for example, our first-year medical students will actually follow a patient journey, but it will be of an adult patient. And they just haven't really thought about including a children's patient journey. So it would be very much them seeing how they impact on each other. Not, as we saw from the quotes from the phase 3 student, I don't know anything about the hospital education service. Well, perhaps I should do because, it might be useful to my future job. Another workshop I'd like to run would be for the professionals, so to include the doctors, the nurses, the teachers, the hospital education service. Again, there was a lot of lack of knowledge really between what happened in the hospital education service and the teachers and the doctors and the nurses. And here, I feel one should include the patient voice, include the parents if not the child. To say, someone ought to be involved, but actually who should be coordinating this education? So here I've just put the top response for each group. So the educational students thought it should be the school subject teachers. The phase 2 medical students thought it should be school management team. The phase 3 education authority. The nursing students thought it should be the school management team. The teachers thought it should be the guidance teacher rather than the school subject teacher, so a move there from the educational students. And the doctors were the only ones who put the hospital education service as the top one, so 27% of them said hospital education service and 27% the school management team.